So firstly, of course, thank you for the great collaboration with ELSA. Thank you, Professor Lomanto. Thank you, Dr. Asim, and thank you, Dr. Sabrina. So now I'm just going to share with you some of the technology behind the smoke evacuation system, and also something that ERBE has. So we have this, what we call the Intelligent Evacuation System, or the IES-3, and this is just some of the products that come along, or rather the accessories that come along with it. So these are just some features of the IES. I'm just going to go very quickly. We're just going to talk about just some of it. What's popular right now, the UPA 15 filter. How noisy is it? And what you can use it for with open and laparoscopic applications. So this is a hot topic right now. I think Prof. Lomanto has done it before this topic as well for the ELSA webinar. So the UPA 15 filter is just a grade given to this particular ultra low particulate air filter, which filters 99.9995% of all particles from 0.1 micrometer in diameter. This sounds too technical. Let's go a little bit easier and see what it really means. So for all different kind of filters, they measure it by the MPPS, or the most penetrating particle size, which in this case, at 0.1 micrometer, particles of this size can penetrate even further into the filter system. But for the UPA 15, it does it at 99.9995%, which is about 5 in 1 million. And for sizes below that and above that, it does it as close to 100%. Now, this is all based on the 4 different basic mechanisms of gas filtration. I'll show you a little bit now. So the easier one is the bigger size. These particles just cannot fit through your microfibers. It's just too big to pass through. Then next, we have inertial effect, which is basically particles that hit onto the fibers, but they do not have enough energy to go around these fibers. So next, for particles that are of that range 0.1 to 0.3 micrometer, we have this barrier effect, which are particles that just join to the fiber because they are of similar diameter and size. And this happens through, if you still can remember physics back in school, van der Waals forces through intermolecular bonding. Lastly, diffusion effect for particles that are much smaller than that. And as all of you guys have shared about viruses and other molecules that can be found in surgical smoke, this is the diffusion effect of particles that are very small. So because their motion is quite random, they call it Brownian motion, they will never travel in a straight path. So throughout the filtration device, is bound to hit at least a fiber. So that in all, you've heard about the UPA 15 filter. Additional to that, we have another 2 more activated carbon filters. These are just basically there to reduce odors, organic and inorganic compounds as well. So if we zoom in a little bit to this activated carbon filter, over here you can see how it actually looks like. So it's all compressed carbon pellets in spear shape into a very dense block of activated carbon. And if you were to measure what's the surface area of this, 1 gram of carbon pellets, the surface area is as large as a football field. So because of this large surface area and how dense this is packed in, the airflow within the carbon filter is slower. And if it's going slower, the chances of it getting captured by absorption is higher. So in the second filter, there's a chemical coating just to help on with additional chemical bonding with all these molecules that you have heard earlier, acetone, butane, and so on. So this whole filter can further be protected even more. You've heard this HEPA filter. So we have a pre-filter that you can just put it before to protect it from larger particles. And in times of COVID, liquid and aerosols are now very big. So on top of this pre-filter, we have what we call a water trap, which basically just captures water through gravity. It just falls down here, and this protects you. We all know that when water or moisture gets into any filtration, air filter like your car aircon or your aircon at home, you know it's going to come with a very heavy bill after that because repair can be expensive. or in this case, a replacement can be expensive. So on top of all these functions, in case your hospital has a regulation that you need to collect this evacuated smoke, there is a tube you can add on and connect it to the central anesthetic gas evacuation system. Now, just very quick, what do these cars have in common with the IES? I guess it's quite hard to guess, but what they have is this thing called the bi-turbo technology. So in the cars, there's a twin turbo to help with a greater air intake into the engine, whereas for us, we have 2 turbines, which just gives you a greater initial clearance of smoke, which just gives you a more effective fast response. So in combination with 2 turbines, there's a max performance of 730 liters per minute. And then, but this airflow doesn't really consider as a big factor, because what happens as you increase the flow rate for air filtration, you actually decrease the efficiency of how the filtration works. So the IES caps it at 300 liters per minute because this is what the optimal filtration effect was determined at. If you're going to go at higher, these particles are just going to zoom through because of that high flow rate. And within all these spaces in between here, we just have some noise absorbing foam, which helps so that when you turn on the machine, it doesn't sound like a car changing gear. So at max performance, we measured the decibel to be less than 65. Now, these are just some other factors that can affect the efficiency of filtration. Of course, what setting you set the filtration at, what is the lumen of the instrument, the tube length, the angle of how you use the instrument. Are you going to use it like this, or perpendicular? And of course, if you're using closer, it will capture as much smoke as possible. And there are other environmental factors like the ventilation within your surgical or your operating room. So the air can flow and create a disturbance in how the suction actually works. So you've seen the some of our toys that you've seen Lomanto share it, you've seen Dr. Sabrina share it. This is the lab tubing that you've seen. It just connects straight to the IES and then via a lower lock to your trocar. Some of the open disposable smoke evacuation pencils. You've seen these telescopic by Dr. Sabrina. And for cost efficiency, we have this clip-on version, which you can just connect it with a reusable pencil. And if you're using a long electrode, you can always use it with the extension tip. So on top of that, in certain procedures, if you were to use 2 surgical pencils simultaneously, we have these TPs for just to split the connection. And for instruments that you cannot connect any suction devices, we have the funnel version where you can just do for open surgeries. And these are reusable. So on top of all this, the IES can be used with other electrosurgical devices just by a simple automatic activation device. You just clip it onto the instrument and it will activate when you activate the device. Or there's the traditional method, just the foot switch. So I think you know there's many different pencils out there, smoke evacuation instruments out there. So just to end everything on with a quick video. So we tested the product with other pencils. And I can't play this now. Okay, so it goes, we hook it up to the same IES machine for both instruments, just to see how it works. So because of all the other factors that I've mentioned, the tube length, how big is your opening, you can always see that the initial suction of smoke leans towards, over on the left here, that's the ERBE smoke evacuation pencil. On the right is the other comparison that we have tested with. I won't say who is the winner. I'll let you decide it yourself. So because of the bi-turbo technology, it creates a higher initial suction of smoke, which is what you want. The quicker you clear that smoke, the lesser chance of it dispersing around in the surgical field. If not, thank you, and then we'll carry on back with the Q&A if you have any more.
Well, guys,